Bisacodyl, also known as woman's laxative 5 mg tablet, is a medication used to relieve constipation and to clean out the intestines before a bowel examination or surgery. This medication is a stimulant laxative, which means it works by increasing the movement of the intestines, making it easier for stool to pass through. It is important to follow the dosage instructions provided by your healthcare provider and to take woman's laxative 5 mg tablet with a full glass of water. It is recommended to take this medication on an empty stomach to achieve the best results. Always consult with your doctor or pharmacist before starting any new medication. When taking woman's laxative 5 mg tablet, it's important to follow the directions from your doctor or on the product package. Swallow the tablet whole and do not crush, chew, or break it. Make sure not to take it within 1 hour of antacids, milk, or milk products, as this can affect the coating on the tablet and may lead to stomach upset and nausea. The dosage of this medication is based on your age, medical condition, and how you respond to treatment. It's important not to take more than directed or to take it more often than recommended. Do not use this medication for more than 7 days unless directed by your doctor, as overuse can lead to serious side effects. It may take 6 to 12 hours for this medication to cause a bowel movement. If your condition lasts or gets worse, or if you experience bleeding from the rectum, it's important to contact your doctor. If you think you may have a serious medical problem, seek medical help right away. Some possible side effects of woman's laxative 5 mg tablet include stomach/abdominal pain or cramping, nausea, diarrhea, or weakness. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. Remember, if your doctor has prescribed this medication for you, they have determined that the benefit to you outweighs the risk of potential side effects. Most people using this medication do not experience serious side effects. However, it's important to contact your doctor right away if you experience any serious side effects, such as nausea/vomiting/diarrhea that doesn't stop, muscle cramps/weakness, irregular heartbeat, dizziness, fainting, decreased urination, or mental/mood changes, such as confusion. While a serious allergic reaction to this drug is rare, seek immediate medical help if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed. As for the optimal timing and daily dosage, it's best to follow your doctor's instructions. Always take this medication as directed and consult your doctor if you have any questions or concerns about its use. Before taking woman's laxative 5 mg tablet, it's important to let your doctor or pharmacist know if you are allergic to bisacodyl or any other ingredients in the product. It's also important to discuss your medical history, especially if you have had appendicitis or symptoms of appendicitis, a sudden change in bowel habits lasting longer than 2 weeks, bleeding from the rectum, or intestinal blockage. If you are planning to have surgery, make sure to inform your doctor or dentist about all the medications you are currently using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to discuss the use of this medication with your doctor, as it is not recommended for long periods during pregnancy. Additionally, if you are breastfeeding, consult your doctor before using woman's laxative 5 mg tablet. Now let's talk about how to use woman's laxative 5 mg tablet. It's important to be aware of any drug interactions that may occur when taking this medication. This can affect how your medications work and increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug are medications that decrease stomach acid, such as H2 blockers like ranitidine and proton pump inhibitors like omeprazole. As for the daily dosage and optimal timing, it's best to follow your doctor's instructions. This medication is typically taken as needed, usually at bedtime or as directed by your doctor. Be sure to read the label and follow the dosing instructions carefully. If someone takes too many woman's laxative 5 mg tablets and experiences serious symptoms like passing out or difficulty breathing, they should call 911 immediately. Otherwise, they should contact a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include ongoing nausea, vomiting, or diarrhea, as well as severe stomach or abdominal pain. Remember to keep this medication out of reach of children and pets. It's important to keep all medical and lab appointments. Making lifestyle changes such as exercising, drinking enough water, and eating a proper diet with fiber-rich foods like bran, fresh fruits, and vegetables can help prevent or relieve constipation. Talk to your doctor or pharmacist about these lifestyle changes to see if they might benefit you. If you are taking this medication on a regular schedule and you happen to miss a dose, take it as soon as you remember. However, if it's almost time for your next dose, then it's best to just skip the missed dose and take the next one at your regular scheduled time. It's important not to take a double dose to make up for the missed one. When it comes to storing woman's laxative 5 mg tablet, it's important to follow the specific instructions provided on the product package or by your pharmacist. Make sure to keep all medications out of reach of children and pets. When it comes to disposing of this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the medication when it is expired or no longer needed. For guidance on the correct disposal method, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.